Now it's time for Onpoint, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. COVID-19 cases have recently been on the rise in South Korea, with daily cases increasing more than twofold compared to last week, with no peak in sight yet.
The country has arguably let its guard down since cases started to slow, but should the country roll back some of its measures right now? For more on this, we have Dr. Howard Lee with us. Good morning.
Morning, and thank you for having me.
First, how serious is the situation in South Korea right now, and when do you think we will see the peak of this new potential wave?
We are riding a new wave of the COVID-19 battle right now. The numbers of new cases and hospitalized patients are on the rise, and they are expected to become significantly greater in a couple more weeks to come. We are basically following the precedents in other countries, such as Israel, Germany, the UK, and the US, with several weeks apart. Based on the previous resurgent experiences, we will see another peak hitting probably in next month. This anticipation is supported by the fact that BA.5 has started dominating the COVID-19 virus surveillance in South Korea quite recently, which rose to 25% last week, almost tripled from 10% a week before.
And Professor Lee, well, the Omicron subvariant BA.5, now that seems to be the strain that's spreading very rapidly, not just here in South Korea, but everywhere else in the world as well. So what are some characteristics that we should really be aware of?
The BA.5 subvariant is by far the most infectious variant we have seen. Scientists call BA.5 immune, quote-unquote, evasive, which means vaccination or even previous infection doesn't help you from getting it. That said, the symptoms are pretty much similar to those caused by other Omicron subvariants, such as BA.1 and BA.2. Mostly, sore throat, runny nose, and sneezing are the symptoms a typical BA.5 patient may suffer from. However, since BA.5 is more infectious and it evades immunity more easily than other Omicron subvariants, it may pose a bigger health problem to the society as a whole.
Right, and talking about society, South Korea has lifted most of its COVID-19 prevention measures, but the government is discussing rolling back some of the measures. How strict do you think the prevention measures have to be this time around? For example, should international traveling be kind of limited again?
I don't think we can go back to the measures in the previous resurgences. People are already tired of strict social distancing. Wearing a face mask, however, is something that we can do, which also has been shown to be effective. The problem, I think, is that we have too many undetected cases hiding in the community. So increasing the number of PCR tests is certainly an option the government should consider, which can become more effective when they are provided free of charge. Banning international travels, I think, is not as effective as we want it to be at this particular moment.
And well, that's of course the vaccination question, of course, Professor. The majority of people here in South Korea are already vaccinated, but is that going to make any difference ahead of a new wave, or are people going to have to now get an extra shot?
As I said earlier, vaccines are not helpful to protect you from getting infected by BA.5. However, I'm not saying vaccines are useless. Quite contrary, they are still likely to provide good protection against severe disease, hospitalization, and death. And this is particularly true for people over 60 and those with less immune capability. Unfortunately, data on the efficacy of boosters against these newer subvariants are still lacking. But if previous experience is anything to go by, vaccines are likely to help reinstate immune protection in those who were infected or vaccinated some time ago.
And Professor, just one more question before we let you go. So in your book as well, you highlight the importance of taking scientific measures in order to address the pandemic. And with the Yoon administration, with President Yoon also having emphasized the same thing, perhaps you read your book, what do you hope to see from the new administration?
Well, I think so far so good. And the new administration, I think, is getting more people from academia, industry, and other areas, not depending on which political stance each person is having on. So I think the new administration has started much better in terms of scientific sort of diversity. In other words, they have been trying to get as much information as possible, as many opinions as possible, which I think is very important. Instead of listening to some people who are politically geared toward the administration, but having more people coming together, sitting on the same table all together at the same time, I think that's a good start.
Certainly, and well, hopefully we will continue to see more scientific, evidence-based policies going forward. And this is where we're going to have to leave it today. Thank you so much for joining us today, Dr. Lee.
Thank you so much.